What causes joint pressure? What I'm demonstrating here for you is a model of two of the vertebrae out of your lower back. Okay. What we're looking at here, as I'm pointing, is the one vertebrae, then the other vertebrae, which sits upon it with a disc, a cushion in between. Now, when we look at the vertebrae from the top, this is called the body, the part that I've been pointing to. Okay, behind the body is the area called the spinal canal. This is where your spinal cord comes through, and it actually sends the nerves from the cord out between these openings. Now, these little tips that you see on the side here and over here are called transverse processes. This is where muscles and tendons attach to move the spine. As we turn the vertebrae around sideways, and we're looking at the back side, this is what's called the spinous process, and this is attachment for ligaments that run down the back. You can actually feel these bones from the outside when you touch your back. Now, as we turn the vertebrae and we look at the back side, now we're going to be looking at what is the joint area. Here's this vertebrae connected to this vertebrae at this joint. As we look over here, here's another one on the other side. Now, what causes adverse joint pressure or inflammation is when that joint actually will slip out of position and jam against the other, as I'm demonstrating. Whether it comes down like so, or whether it goes like this and positions itself, it creates pressure in that joint. What happens then, there's going to be inflammation occurring here, and of course the muscles around this area of the spine will go into spasm, and there's going to be pain in the muscles. So that's what causes adverse joint pain and inflammation.